so proud to be Haitian because just everything about being Haitian is just awesome.
You know, everyone know about the history of Haiti, first Black independent country in 1804.
Understanding the history of Haiti or Haitian people, you can't help but be proud of the accomplishment that have happened.
Haitian Americans have done really well in the past few years. There's still a lot more work to be done. Only about 20% of us actually have a bachelor's degree.
I understand firsthand some of the challenges that Haitian American students, graduates, and professionals have faced.
Some of them have overcome incredible adversity.
Both immigrated or asylum seekers or refugees.
There are not that many Haitian-focused scholarships, but like any other award, the NAAHP Leadership Award is providing recognition for one's hard work.
As we know, college is expensive, so this scholarship fund provides the chance for a brighter future.
It felt like the universe was speaking, like I needed the money, I was intrigued, people were telling me to apply.
Going to college or graduate school can be very, very expensive. So donating to a scholarship like this would help that expense be more manageable.
Future generation of leaders, scholars, entrepreneurs,
young adults that are trying to make something of their lives.
They are rock stars. They just need the help, and they need us to help them accomplish it.
There's like this Haitian proverb that says, "Mais en pile chat palu," many hands make the load lighter.
Log in and you can donate $10, $25, $50.
It makes me think of the Malcolm X quote that education is our passport to the future, for tomorrow belongs to those who prepare for it today. It makes me happy to know that our organization is contributing to that goal, preparing others for the future.
Well, good afternoon. Good afternoon, everybody. It is a pleasure to be here. Dr. Mona Lisa, how are you today?
I am great. I'm wonderful. And it is my utmost pleasure to be here with you, Johnny, to co-host this wonderful Diaspora Townhall, which is brought to us by three wonderful organizations. First, I want to mention the NAAHP that has done a great job putting this event together. And on behalf of Sergio Renaud, their president, I want to welcome everyone. Also on behalf of HAAHP Coalition, on behalf of my board, and I'm a part of this wonderful coalition, Vanessa Joseph, and NAAHPN, which is the National Haitian American Elected Official Network by President Alex Desilme. I want to welcome everyone.
Wonderful. And I think this is another one of those amazing collaboration, which has the objective of really trying to help the community better understand some of the most important issues that are affecting not only our community, but indeed the world. And so it is also a wonderful illustration of how our organizations are working together to bring the information that our community needs. So I am so amazingly happy that the Mojo is part of this amazing and fantastic collaboration. And we want to also say a few words to a lot of the partners that really made this possible. Of course, the Mojo Show is a partner. Chocarela, Book It Right, Accountancy, Telepam, Teleimage, and of course, our sister friends, the VSS Hour. So again, a wonderful collaboration amongst a number of organizations and institutions within the Haitian community who are working together to bring much needed information. And the three amazing panels, which have some people I'm excited to listen to what they have to say, because they are expert in the fields that they're in. And they're just gonna really blow our minds away.
Absolutely. Let me also add, Johnny, there's no better time to bring this wonderful event together. As you know, this month of May is the celebration of Haitian Heritage Month. So on behalf of all these wonderful organizations, once again, I want to wish everyone a happy Haitian Heritage Month. Let me talk about our first panel, which actually focuses on COVID-19, which has actually devastated the entire world. And panel number one, which we'll talk about the COVID-19, the vaccines, and its impact on the Haitian community, actually has an esteemed guest that I currently I'm working with, and it is a wonderful judge, the Honorable Judge Dwayne Esther Paul. It also has our wonderful Dr. Marcel Benoit from New York City. And I'm going to allow you to present the other guests, Johnny.
Thank you. And, of course, it has Council Member Christine Ellis, and each of them will, of course, introduce themselves. It has Dr. Guerda, Dr. Guerda Nicolas. So we really have an amazing panel that is going to be part of this first panel. So before we do that, let's introduce our moderator, who's going to come on and take over this first panel. I really want to, first of all, I guess, faut nous dire bonsoir.
Bonsoir. Thank you for having me.
Deuxième bagay pour nous dire, nous pas gen chance de dire ça avant, faut que nous dire félicitations pour gros coquin chaîne événement, bon, pas l'événement, mais how do I say this milestone that you've reached? That's really the commissioner, a young commissioner. So really, félicitations pour gros achievement.
Merci en pile. Apprécier tout ce support de communauté. Tout le monde connaît moi ces petites communautés. So I'm so happy to be representing not only as the first Haitian American, but the first Black woman to serve in the seat as Coral Springs Commissioner. So again, thank you for having me, everyone.
So let me I know we brought you on and you're going to take over this panel, but I just want to tell everybody, that you are an amazing woman who is, and I know I've heard you speak before, you are an environmental scientist, a former member of the Broward County Soil and Water Conservation District with a decade of public service experience. So you may look young, but you have some experience behind you. You've been a leading voice on these issues ranging from environmental advocacy to disaster relief. You have a strong record for championing community resilience and building pipelines for access and equity. You're a graduate of A&M University, where you receive your Bachelor of Science degree, and Johns Hopkins University, where you receive your Master's in Health Science. So, Nancy, welcome, and we'll turn over this panel to you, and we are going to sit in the back and listen to this amazing panelist.
Thank you so much. Sometimes it's really hard to hear people read out your bio and accomplishments, but I truly appreciate it. Good evening, everyone. My name is, again, Nancy Metayer. Honored to be here. Again, I'm going to say thank you to the National Alliance for the Advancement of Haitian Professionals, NAAHP, Haitian American Voters Empowerment Coalition, also known as HAV, and the National Haitian American Elected Officials Network, NAAHP. And to you, all the viewers who are watching this evening. I am proud to serve as Coral Springs Commissioner. It's a city here in Florida, and I am looking forward to discussing COVID-19 and its impact on the Haitian community. But I will not be on this live alone. I have some great panelists who will be joining us. First, I would love to introduce Councilwoman Christine Ellis. Councilwoman Ellis was born and raised in Haiti and has resided in Chandler since 1987. The council member has a Bachelor of Science in Nursing from Grand Canyon University and has worked as an RN for many large hospitals and care facilities while holding many high-level positions as Director of Nursing in the Metro Phoenix area. Welcome, Councilwoman Ellis.
Thank you so much for having me. I really appreciate being on the panel with you tonight.
Absolutely. Welcome. Next, I would love to introduce Chloe Burke. She is a Florida native. She earned her bachelor from the University of Florida and completed a JD MBA at Northwestern in Chicago. Chloe conducted her business rotationals abroad in South Korea at various Forbes 500 companies. Her professional experience has included working in the legal sector at Holland & Knight and in policy at the state and local levels, as well as abroad throughout Latin America and the Caribbean. Welcome, Chloe. Next, I'm going to introduce Dr. Mona Lisa Ferrari, the founder and president of Fuji foundation of the emancipation of women and girls. She is a multi-talented entrepreneur after having established her career as an educator, community leader, media expert, innovator, philanthropist, as well as managing Ferrari and Associates International LLC. She also is the deputy campaign manager for Judge Paul, who we will have on this panel as well. Thank you for joining us. And then we have a Judge Dwayne Esther Paul, who is a Kings County Civil Court judge elected in 2015 from Bedford, Brooklyn. Currently, Dwayne presides over cases in civil court hearing small claims, commercial landlord tenants, consumer debt, first-party benefits, personal injury, and other civil trials with experience, integrity, and compassion. Welcome, Judge Paul. Just want to check, do we have our other panelists, Dr. Nicolas with us? Okay, I guess we will move on, and as soon as they come in, I will go ahead and introduce them. So welcome, ladies. How are you?
Wonderful.
Very well. Thank you for having us.
Yes, of course. So my first question for you all and for everyone who's watching, want y'all to think about this. Council member Ellis, your background is in nursing, and recently the Washington Post reported that National Nursing Union is calling on the Centers for Disease Control and Prevention to revoke the mask rule. As a nurse, do you agree with this? If so, and why?
Well, at this point, what we are looking at is we have said that we've been following the CDC guidelines. And if we are following the CDC guidelines, wherever they go, that's where we tend to go ourselves. But nurses have always been very big on infection control. As a matter of fact, in 2011, I was appointed on the board of infection control here in the state of Arizona over the whole state. I represented the assisted living world because that's where my business was. At one time, my sister and I, we owned 19 assisted living here in Chandler and Scottsdale and also Gilbert. While we were doing all of these things, the one thing that we focus on is the fact that nurses know how to take care of themselves, no matter what. No matter where we go, we will be able to do that. The CDC is telling us right now, if we are vaccinated and we are also able to continue to be in large gathering, we can do so without a mask. But in a hospital setting where we are working with clients, whether they have COVID or not, we are asked to protect ourselves and also to protect our clients, whereby our clients might not be wearing masks, but the nurses, they have to wear their masks. And so this is where I am standing right now in public venues and other areas. Those who are vaccinated, by all means, follow the CDC guideline. And us nurses in the hospital setting and places where we are rendering help to other clients, we will protect ourselves and our clients by wearing our masks.
Thank you for that. I know that has been a hot topic in the news right now, and everyone's just really, really conflicted. How do you transition from wearing a mask and being told that you have to wear a mask for over a year to now being told you no longer have to do it, especially in areas where we know the pandemic has really hit communities really hard? I'm speaking of South Florida, where we had a large number of COVID cases, and folks are just like, listen, I'm going to keep my mask on whether or not CDC recommends it or not. So thank you for sharing that and really walking us through what your folks are doing in hospitals and just how essential you all are. So thank you for that. Quickly, I want to introduce Dr. Marcel Benoit, who just jumped on. If everyone can go ahead and let's welcome him. He's an accomplished nephrologist and surgeon from New York and a national speaker on hypertension, diabetes, and chronic kidney disease. Welcome.
Welcome, everybody. Welcome. Pleasure to be here. Pleasure to be among all of you, and hopefully we're gonna have a good time together.
That's for sure.
Absolutely. So my next question is for Ms. Burke. Chloe, you have worked in both the public and private sector, domestically and internationally. Some reports indicate how diverse and vulnerable populations are and disproportionately affected by COVID-19 and the infections and deaths. How can we address the health equity challenges highlighted by this global pandemic?
Sure. So again, thank you for having me on. And for those of you watching, I hope that you're enjoying your Sunday. This is an excellent question and a really loaded question. It's a big one. I would say, and I want to talk to you like direct things that you can do now, and then let's look at this in a macro picture. So things that you can do now to address health equity are, one, get involved and be engaged. And one of the ways that you can do that is there's often a misconception that in order to participate in the healthcare space, that you strictly need to be someone who works in healthcare or you strictly need to be a doctor. And that is not the case at all. We know from this pandemic, it's not just the information, but it's also the information source that matters. So that means if you have a bit more access to information, if you are a trusted decision maker in your family, if you take the time to get informed and share that with your community, that will make a substantive difference. The second piece is find your local health clinic. Find out what ways that you can support. Sometimes that means language support. Sometimes that means volunteering with health screenings. Sometimes that means simply sharing information in your community about opportunities. There are so many careers around healthcare outside of medicine that many people don't know about. And I think that's a pivotal component of health equity. And then the third piece is to really learn about clinical trials. I know that our community has a lot of historical mistrust around clinical trials, and that is warranted and it is valid. However, we know that putting our hands up to crises is really not a form or choice in terms of working towards a solution. So finding more about clinical trials, getting involved. Many may not know that actually when you wear something like an Apple Watch, the heart monitoring device within that often goes to a clinical trial. There's an economic benefit that goes to that, but there's also the part of making sure that data analysis in clinical trials is equitable, and that means us participating. So that's one way that directly we can involve. But the other part is there are things that need to happen upstream. And by upstream is we need concerted support both in healthcare, from government, from the private sector, and from our communities to really blur the lines between healthcare and community organizations. We need to work on ways to build trust. That requires us making sure that we are at the table, that decisions are made with us and not just for us. And we also need to look at really making sure that medicine is less homogenous. This is a very homogenous field serving diverse populations, and that's a problem. It's not just about being educated in healthcare, it's also about being educated on the mindset of the patient. And that has a larger context within culture, gender, sexual orientation, religious beliefs, and socioeconomic realities. And so there's a lot that entails health equity, period, but at a high level, get involved, stay engaged, think about the social determinants of health, all those other factors like education, income, all the other factors around health that really affect our mortality rates, our infant mortality rates, our death rates, our life expectancy. It's becoming increasingly clear in COVID particularly that it's not just about health insurance alone that will address health disparities. Merely increasing the availability of healthcare services doesn't necessarily reduce healthcare disparities. Correct. Confronting the institutional racism within these organizations that really have policies and norms that perpetuate race-based advantages is something that we have seen has exacerbated our communities. And so get involved, stay engaged, and learn more about clinical trials.
Ms. Burke, you dropped some gems. I resonated with everything that you said. And I saw head nods. I don't know if Dr. Benoit or Councilwoman Ellis would like to chime in before we go into the next question. But I think this is an important piece where we can continue having some dialogue, especially within our Haitian community. There is a lot of mistrust about getting the vaccination and seeing our doctors. You know, we really rely on our herbal teas and like you know, like so many holistic approaches, but those holistic approaches are not going to combat this virus. So I really want you all to chime in and bring it home to our Haitian folks who are watching this evening, like encouraging them, like there are some barriers to getting this vaccine, but we are ensuring that there's a pathway to get the vaccine, but we're not getting vaccinated. Like, if you can just share 2 or 3 words on why it's important for our community to get vaccinated, I would truly appreciate that.
For me, particularly, getting involved is very important. When she said that, it just kind of, it was almost like a boom. There it is. You know, we have to get involved here in our community in Chandler. Most of our Haitian population that was really engaged into really getting sick was those who were working in the nursing homes, because that's where we saw that. And again, when she spoke about getting the information here in Chandler, we were not getting the information how many of the patients in the nursing home were being tested positive, because it was because of the law HIPAA. HIPAA was saying that they can't tell us how many. So we couldn't make any decision for the people that were working there, because we didn't know how many of the patients that were also positive. At that point, what we started to do was asking people to start taking care of themselves and get involved in the community. I rose up with an organization called Protect AZ. And we started going into the community to test people. We started with the homeless populations first. Then we were all over. We were flying even into the American Native reservation areas. We were in there doing those kinds of testing because we wanted to get the information to them. We wanted them to not only to wait for us, but for them to come to us and get involved. When the education part of it, we really started flooding everybody that were working as a caregiver, as a CNA. We started telling them, don't wait for them to tell you, here's your PPE, do this and do that. Just get out yourself and start telling us, your city government, tell us what you need so that we can give it to you. Have a voice of your own. So I started to empowering those that were at the grassroots in our community to rise up and start speaking for themselves, each one individually. And then we became such an echo, nobody could ignore us. So at that point, that's where we started to really making a big impact on that.
Well, this is a segue to the next question, and this is for Dr. Benoit. John Hopkins recently put together a myth versus facts. It's along the same lines in regards to the vaccine. As a doctor, what are some of the myths that need to be addressed so folks can feel comfortable in getting the vaccine? One of the major ones that I hear is, I've already had the virus, I don't need the vaccine.
I think that we touch on very important points here. And they have to be emphasized. First of all, we have to get involved. And at the onset of the pandemic, as you can notice, that 78% of the American population was not really fixated to be inoculated. There was a lot of mistrust about the vaccine at the beginning of the vaccine. And with education, and a lot of people have been vaccinated. And I, for one, have tried my best to convince the diaspora in general to be vaccinated. As you can see now, only 22% of the American population is a little bit hesitant about the vaccine. But we Haitian, we are culturally ingrained by certain myths, and I think that they are responsible for the resiliency of us to get vaccinated. For example, they tell you that if you boil lemon tea with honey, with hot pepper, you get cured. You boil eggs, you do all kind of punches. You get healed. And there's a preponderance of misconception, of myth in the diaspora it is show like this can really deter people to listen to the science and listen to the science again. As one panelist mentioned, that true enough, the history between clinical trial and Blacks were not the best. But right now, we're not at that point anymore. We're not in that stage anymore. Too many Blacks are well educated now. We are at the avant-garde. So the myth is very serious, and I think that we should continue to educate the community, to show them. Now, let me give a brief example. Now, I work both in the hospital and a nursing home. Since the onset of the vaccine, I have not reported one case of COVID. One case of COVID. And this is evidence-based medicine. It is not, this is tangible. This is real stuff. As you know, this population was the most vulnerable at the onset. Since the onset of the vaccine, not one case. And all the patients who are transferred from the nursing home to the hospital is for something else other than COVID. So, and this is what I try to convey to my audience many times when I talk to them, that the vaccine works. But again, we have to deter those myths in the Haitian population. We have to re-emphasize the education. It's a long fight, but we have to do it.
Could I add to that? I absolutely echo the doctor's sentiment, and I think what he said at the end is really important and key. Is that this is an ongoing work, and I think this is the one thing I hope we take out of COVID, is that this is an ongoing work that has to happen in our communities, and not only in times of crisis. That we don't just show up in times of crisis, but there's ongoing communication in our communities to build trust over time, and making sure that we're engaged in a steady manner.
That's right. Very important.
Dr. Councilmember Ellis, would you like to jump in?
Yes, at this point, what I was going to say, it's not only to stay engaged, Ms. Berg, but also to be that voice that's going to always be in their ears and saying, "I'm here. Look at me. I'm here." When you're doing the clinical trial, don't forget us. Even though we have such a hard time participating in those kinds of things, but I believe if we keep engaging people, we keep asking them to be part of it, and some people will, and they will get involved, and they will come to the table and said, "I will want to do that for the good of humanity," because we are not living in a vacuum. We are not on an island by ourselves. So we have others that are around us. Whatever we do is going to reflect, and it's going to help them in every other which way that when it's help us. There was a group of older people that we were working with, and we could see how their psyche and their mental status, because my background is in mental health. They were literally depressed because they couldn't go outside. They couldn't do the things that they wanted to do. After the first dose of the vaccine, just the idea, now they know that they have a protection and a shield. When we came back with the fire department to give them their second dose, those people were alive. Their eyes were brighter. They were engaged in conversation. They were laughing because at this time they had a pathway to their health. They knew that the first dose was going to help them, and the second dose was going to even be better. So it is important for us to keep telling people that they have to be engaged.
Can I interject a little bit also? And I think that one mention about the vaccine, we have to emphasize that one dose is not enough. We have to emphasize to the community, to the diaspora, for you to be fully protected, you must take 2 doses. By taking 1 dose, you're not doing yourself a service. You're putting yourself at risk. So once you are scheduled for your second dose, you must do your diligence to follow up and get your second dose.
Correct. Perfect.
Thank you for all of that insight around the vaccination. Now I really want to pivot a little to outreach. Myself and a few of our NAAHP members, elected officials throughout the country, talked about how hard it was around outreach and ensuring people were getting the right information. So with everyone on this call, well, the conversation was with the White House, but they were struggling with getting everyone vaccinated, right? Or that outreach and that messaging within our community itself. What are some, for everyone who's watching who works in different sectors, what are some advice or some insight that you can give so we can do some better outreach in terms of information about COVID? There's some miscommunication about the mask. There's miscommunication about the vaccines and the various side effects. How can we eliminate a lot of that, and how can we reach more of our Haitian folks?
I think the first step, knowing our culture, I think the most pivotal place to get Haitian to be compliant is the church. We have to start educating the pastors.
Yes.
We got to teach them. We got to lay out the science to them, make them believe that the science is real, and then the pastor will relay that to the parishioners, and at least we can get a better compliance with the diaspora. And the second, also, we must have a voracious campaign through radios. Haitian love listen to radios, all right? And Haitian love to listen to all these Facebook lives. You know, we got to find a way to interject the message in this. So we need a voracious campaign, and we know exactly what Haitian love to listen to and to enjoy, and we gotta try to find ourselves to relay the message that way.
If I could just chime in real quickly, I would also want to say that, you know, we just missed a great opportunity with Haitian Flag Weekend, right? This is when everybody is in the streets, everybody is celebrating May 18th. I think that was a missed opportunity. I think that we could have definitely galvanized and gotten either people to vote, but that's another thing, register to vote, or get them signed up for their vaccines, giving them more knowledge around where they can go, and more updates on what CDC guidelines are. So anybody who's listening, who is continuing to have activities around Haitian Heritage Month, please take that from a lens and incorporate it into any of your marketing and your outreach. I'm going to pivot to Councilwoman Ellis. Go ahead.
Yes, what I was going to say, when everything came out and the primary care doctors were left out of the equation of diffusing the information in the community, I was very sad about it, because we all know that we will do whatever our doctors tell us to do. And those who do not have a primary care doctor, if they go to a clinic or wherever that they receive health care, I thought that this is the part that we missed out on, getting those doctors involved. They didn't have the test. Some of them still don't even have vaccine with them to give to people. And I thought that we really forgot that segment. Had they been a partnership with a leadership in that, making those decisions, we probably would have covered more people by now than we are at this point. For us here in Chandler, we started with our fire department coming to council meeting, giving us report by taking information from the CDC and then compiling them from the hospitals that we have and all that information and bringing it to us. And then from there, we were diffusing it down to people. But I was so saddened that we did not have a coalition of primary care doctors and community health nurses to put them together in order for us to go forward with with this message. People will do what their doctors tell them to do, just like our doctor here told us that the church, people will listen to their pastors. But I think that their doctors really have a big weight into telling them how, because this is a health issue, how to manage their health care, because this needs to be left on the lap of the primary care doctors, educating their patients what to do next for their health.
Great. Chloe, would you like to jump in?
I'd love to. I echo both points of, again, coming back to, it's not just the information, it's also about the source. And so ongoing relationships is really important, and making sure that we are at the table. On the other side of it is also thinking about our younger generation. Yes, the church has really been an important pillar for our communities, for certain demographics, but that is changing, and the realities of that is changing. And so what do we do with this next generation? They have been engaged, they are out, they are protesting, they have been in the forefront of the reckoning of this past year. And so also thinking about the private sector. The private sector and healthcare are collaborating all the time, meeting our information where we are. We communicate on WhatsApp. A million times we have received lots of information through truthful and untruthful. And so meet us where we are. That means data light advertisements that can be passed quickly on WhatsApp. That means communicating with doctors who look like us. That means all of the community leaders that we've seen at the forefront of the protests who look like us too. And so the messenger, the message, but also making sure that it is consistently in our community and not only in times of crisis. So I would say the other part is thinking about what is the sort of long-term of hospitals and medical schools investing in early childhood education, of like, if this is a constant thing that we're seeing over time, then these are relationships we have built. And then lastly, I'd love to see in the infrastructure plan that our president is working on, of just really ongoing collaborations in our community of what will be the steady drumbeat even after COVID.
Thank you. Well said. I'm enjoying this conversation. We actually have two questions from folks in the audience. I know we've been focusing a lot on vaccines, and we're going to go back to that. So this is for Dr. Benoit. Can you please shed light on the blood clots associated with the J&J vaccine, Johnson & Johnson?
Okay, so the J&J vaccine is, as reported, when the CDC has given the emergency authorization for the J&J vaccine, by the time they reported the thrombotic events seen with the J&J vaccine, there were 8 million people. There were 8 million doses given to Americans. Now, the type of thrombosis, the blood clots that you see with the J&J vaccine, it's within the vein. It is called central vein thrombosis, whereby that when you have a clot from a stroke, regular stroke, is within an artery. It can be what you call the middle cerebral artery, which is the most common artery that is afflicted with a stroke. And the treatment of both is different. All right. If you try to give a patient heparin with a clot that is caused by the J&J vaccine, you're going to cause more problem. Yes, you can use other anticoagulant or anti-blood thinner, but nevertheless, the treatment is different. So basically, what the patient would experience: headache, abdominal pain, feel like nauseous, dizziness. Now, when you look at the number of people, 8 million people, 8 million doses were given, only 6 cases of blood clots. That means it's a 1 in 2 million. And it is commonly seen in young female, 30 to 45. So that's why right now they will stratify who's going to be eligible for the JJ vaccine. If somebody you're 50 years old, JJ vaccine is a good vaccine. But if you're younger, young female, probably the JJ vaccine is not a good vaccine for you. But overall, the vaccine has received a lot of bad rap, and there's a lot of mistrust about the vaccine. Yet it is hopefully it is quite a deficit for the for the world, because JJ vaccine is a good vaccine, and the efficacy is as good as Pfizer and as Moderna.
Thank you so much, Dr. Benoit. We have Judge Dwayne Esther Paul with us, and I'm going to pivot really quickly and really discuss some of the legal aspects around COVID and the vaccine. So, Judge Paul, the state of New York, where you are a civil court judge, has reported 63% of adults having received the first vaccine. The country, however, has only at 39% have been fully vaccinated, and 49% have received the first shot. There is now an intense ground game to help push those numbers up. Will the grassroots push work? And how can we help in this effort to push those numbers up legally?
Okay. Hello, everyone. Hello, everyone. Thank you for allowing me to join the panel. I've been backstage listening in on the deliberate and intense and thoughtful dialogue that you've all been having. And, you know, this pandemic struck our community very, very hard. And so when we think about outreach and getting the word out, some of you have already talked about some strategic ways of that grassroots spread. You know, when we talk about campaigns, a campaign can be about anything. And in this regard, we really need that grassroots efforts and campaign to help spread the word about how we protect our health under these circumstances. And really, I think it can work in terms of that grassroots effort. And that is truly the way that it's done. I heard you were mentioning about clergy and clergy outreach. And in terms of the legalities of it, you know, there aren't any limitations per se to how we can really spread the word in our community. But when you think about where we receive our information, you touched on it before, that we really look to our civic leaders for that voice of someone that we trust in understanding this process and navigating it. And another thing to consider really is what the impacts are on us as a community after the pandemic, after we already lost loved ones. And I know our focus is about prevention and getting to a place where we can become vaccinated and we can, to some degree, return back to normal. But when the opportunity arises, I really would like to talk about, so now we're living in this. Those who we've lost, you know, whether they were able to secure their assets and get to a place where their legacy is preserved for that next generation. And what options do we have now that we have experienced this pandemic and we didn't have an opportunity to say goodbye to our loved ones, much less plan for death. But now we have this window. So we focus in on prevention and staying as healthy as we can as a community, but we also want to make sure that we are financially and economically healthy and preserving and putting ourselves in the best light and as possible to educate the community about wills, trusts, and estates, and really planning for that wealth building and that legacy building when and if we pass away.
Absolutely. And I think people get so boggled down on just trying to survive, right? And we're not thinking ahead and what that means, especially within our community. We come here, working, trying to get our families, sometimes supporting our families overseas. And now we come with this disruption in our daily lives where someone has passed away, and then now we have to figure that out. So another, not to pick on you, Judge, but another question for you. During COVID, a lot of folks were laid off. They couldn't pay their bills. And then we have these landlords who are pushing people out of their homes. What advice, legal advice, can you share with folks who are experiencing those hardships now?
Okay, so first, my disclaimer: judges can't give legal advice, but I can give information. And so you are right. And I'm a civil court judge now. And so what part of the work that we've done during the pandemic is try to navigate commercial landlord tenant businesses, because we saw so many small businesses, mom and pop shops, who put their life savings into their restaurant, their small business. And they were struggling. They couldn't pay the rent. And you really even had mom and pop landlords that didn't have a lot of cash, right? But was able to acquire something, rent it out. And both of us were struggling. Both sides were struggling, landlords and tenant people, homeowners who couldn't pay the mortgage. But the state did put a moratorium on evictions. And so while the court was closed to some regard, essentially, we were still doing emergency cases. And so if you had a case where you were being wrongfully evicted from the property, or you had an issue between the landlord or tenant, an emergency issue, something that dealt with your living environment, especially because there was a directive not to go outside. And people couldn't move as freely. So there was a moratorium from the state that held off on all evictions, even evictions that were in the process. And that moratorium is still there, where there's a hold on evictions. But if there's something emergency, the courts are open where you can go in and we can have a hearing on that issue to make sure that people are not being wrongfully, people are not taking advantage of the community and evicting us during this hard time. So the courts are open. What we're doing now is majority of the cases are virtual. You can contact the court if there was a case that was pending, because the idea is that your case would not be dismissed under these particular circumstances. But as the vaccines move through our cities, the courts are opening back up, and that moratorium is scheduled to be lifted.
Thank you so much for that, Judge Paul. We've gotten 2 questions from the community for folks who are watching right now, and anybody can jump in and answer if they would like. So this question states, how do I convince my community to get vaccinated knowing that it won't protect them from COVID, and then explaining to them that there might be a necessary booster every year?
For some reason, I did not hear the question properly. One of our mic it's giving a lot of feedback.
Okay. I will repeat that one more time.
Thank
How
you.
do I convince my community to get the vaccine, knowing that it won't protect them from COVID, and then explaining to them that there might be a necessary booster every year?
Well, the only thing I can say is that it's a SARS virus. SARS, as the doctor will explain to you, I'm not really a scientist, so I don't understand all the concept. But the one thing we can compare it to is like the flu. You know, with the flu, we do take a booster of flu vaccine every year. So what I will tell people is making sure that the immune system that your body comes equipped with, you need to start taking care of that immune system, because you can't rely solely on the vaccine and also the things that, you know, people just tell you to do, or just medication. You have to build your immune system. We are made in a way, or created in a way, that we can heal ourselves in so many different ways. We mentioned that earlier, like for us Haitian, we are very big on bush tea, things that we can take. And we know we grew up with those things, and they took care of us from the time we were little. We are saying not only take the vaccine, but also take care of yourself. Eat right, get good sleep, take care of yourself, ask questions about how to do those kinds of things. So it is important that you don't think about the fact that you're still gonna get it, but it's the fact that if you get it, you're not gonna get as sick just like when you take the flu vaccine. It's not that you can't get it and you will never get it again. It's not a cure. It's something that helps you it protects you in a way as a barrier so that you don't get as sick as you would have or die from it if you get it. So that's one way we can explain. The second way, again, as I mentioned earlier, is encourage your family members. Drink your teas, take care of yourself, take vitamin C's, take your zinc, take your D3s, all the things that you have to do. Eat properly, get good exercise, get out and walk, take care of yourself. So that on itself is going to help you to build up so that you don't have to truly keep getting it. It's not everybody who takes the flu vaccines every year. People don't usually do that because they take care of themselves. So that would be a good way to do it.
Dr. Benoit, do you want to add?
Yes, but I think that we have to emphasize and re-emphasize that the vaccine prevent the transmission of the virus, and as well prevents serious disease. It prevents all three indicators. It prevents new cases, it prevents hospitalization, and it prevents death. So I think that when we're trying to relay the message to the community, we have to make sure to tell them, yes, indeed, the vaccine will prevent you to catch the virus. Now, it is not 100%, but 95% efficacy. Now, as far as booster shot is concerned, as one of the panelists stated, that we know that we get a flu shot every year. It's like a booster. So, and we have to start thinking that COVID will be with us for a long time. That it will be just like every year you get a flu shot, you're going to be the same thing. So I think the work that has to be done really, because if you tell them that, oh, well, if you take the vaccine, you're not sure that you're going to be protected, that's not the best route to take. You got to tell them you take the vaccine, it will prevent you to transmit the virus to your loved one, to others. It'll prevent you to get sick. It'll prevent you to get hospitalized. And the worst nightmare you don't want to deal with is death. So I think that those things have to be really, really emphasized.
I think another really important point coming from a point of empathy and trust is we can't afford to go back. And that transmission is real. And so the vaccine is one tool and a larger tool chest of we cannot afford, and particularly our communities, we cannot afford to go back.
I agree.
Very good points. Now I'm going to pivot the conversation to mental health. And this can be something that we all chime in. First of all, I don't know how you all are practicing self-care, especially in this work, especially in COVID, but I encourage you all to practice self-care, to do so, because it's so important. As we are, whatever sector that you're in, you're ensuring that our communities are getting the resources that they need to combat COVID-19, get access to the vaccines, et cetera. So please, practice self-care. So that's my disclaimer. So this question is directly for Councilwoman Ellis. COVID-19 is causing a lot of fear, worry, and concerns in the population at large. From seniors with underlying issues, adults trying to make ends meet, students struggling with school, and now a vaccination process that is not moving as fast enough. Together with partners, how can we provide guidance and advice to members of the public to help them look after their mental health?
One of the things that we are doing here in Arizona, it's that our governor, for the first time in ages, have decided that mental health really, truly, is something that we needed to tackle. So he has been really putting his money where his mouth is, literally. So we have been really flooding our community with resources to get our mental health providers to rise up to the occasion and start providing self-care. In our schools, we are seeing a really great increase in suicide. In the homes, we are seeing battered women, battered men, or being alcoholism has gone through the roof. The police have been called constantly, 15, 20 calls an hour for people who are getting into trouble. And when the police get there, they don't know how to handle it because they are not trained as mental health providers. They are trained as peacekeepers, right? Not mental health providers. So what we're doing here in our communities is bringing together all our providers and seeing what is the pathway truly to keeping your mental health in this epidemic. We found out that because we were so separated and people were so alone, one of the ways that we could do it in the first place is to try to bring people together to different community. What we did is that we opened our parks where people can actually get out into the parks with their own families and spending time alone with them, whether in a corner of the park or different areas. We went with our restaurants, we enlarged their borders in selling different drinks where people can come and get their drinks and get their food and go in the park and sit down with their families. We started to very, I will say, rigorously push the idea of a mental health court. We started to work with our court here in Arizona, where when we pick someone who's experiencing homelessness, or when we pick someone that is having a problem with domestic violence, that they will go through that specific area of the court. And then instead of punishing, instead of putting them, we would put them to a 26-day class where they will learn how to manage their anger, how to manage different things like that. And as far as like helping with those who are experiencing, because economically they become so overwhelmed, they can't pay their mortgages, they can't pay their rent. And then they have to also try to teach their kids how to read because they are doing school at home. So what we've done is that we put an $8.3 million into our communities, helping paying rent for people who were on the verge of getting laid off. For the businesses, those who own businesses and they were going to close their doors, we put up $9.5 million in there to help businesses not to close their doors. So all these little things, as we do them one-on-one with people, finding them, going into the churches and telling them, start talking to your people online, having classes, small group, discussing this. Let's talk about what's going on with you personally. How do we get people engaged and stay engaged with them throughout the whole process? It's not that we just say, hey, how you doing? And we walk away. We say, how you doing? And then the next is, what can we do to help you in this moment where you are? And how can we help you navigate what you're going through in order for you to get over this or get to the next level? And we never leave people behind. One of the major things that I think that really helped us also, we hire a few people called navigators. Those navigators, when someone is experiencing, let's say, a crisis, they are into what we call psychosis. Those navigators will show up at their doors instead of police. And those navigators then will do what we call a wraparound services. That wraparound services include finding out, are you going to be evicted? What is it that you need? Food. Then we to those who were having food insecurity. We started to make sure that they get food to eat. We started to making sure that those navigators stays in those people's life. If they need a social worker, if they need a priest to come or a pastor to come to their homes. So all these little things along the way help us to navigate. That at this point, we feel that we were able to really interfere with a lot of people who were not going to make it. But we can greatly say today that they are making it and they are strong into their mind because of that.
That was great. Would anybody else would like to chime in around mental health?
I'm happy to share two resources. I know that sometimes it can be challenging for us as people of color to find therapists who look like us. And that sometimes is a threshold. And so there's great technologies to support with that. There's an app called Health in Her Hue, HUE. And you can filter there by ethnicity, you can filter by gender, and you can also put in your zip code. And that is one mechanism to be able to very easily be able to find therapists who look like us. There are also really affordable apps like BetterHelp. I think they charge maybe $40, and I know that means a lot of different things for a lot of different people. And then the last thing, if there are those in your community, sometimes they have different pricing ranges. And then also thinking about reframing, if you are a person who is already in our community seeking help or who has gone out to a therapist, talk about your experience. This is often seen as really taboo, and it's not something that is around our social tables. But if we break that barrier, we break that wall, then it will become a norm like a lot of other things. And then lastly, for me in this pandemic, I have been really intentional about constructing times for joy. So for me, just the reality of my schedule is really busy. For me, that literally means I schedule in like any other Zoom call, any other meeting. At this time, I'm going to experience joy, and I plan in advance what that's going to be, whether that's being outside with my family, whether that's at the beach, whether that is just sitting on the patio. Literally writing down a time for that has been helpful to me, and so I would highly encourage you to schedule it.
If I can chime in, when we think about mental health, sometimes it's connected to domestic violence. And so we found during the pandemic challenges in the community because we were asking people to stay home. And if you have issues of mental health or if you have issues of domestic violence in the home, then that became very challenging. But the courts remained open for those types of emergency cases. And so if you did suffer, if you are engaged or know someone who is struggling with some degree of domestic violence, and domestic violence shows up in different ways, in different forms. Sometimes it's not physical. Sometimes it's economic control over someone, just that concept. And then there are children in the home who are secondary to that type of mental health issue or domestic violence. And so the courts are available, both family court and criminal, to receive resources. And sometimes that resources is not removing someone from the home necessarily. It may just be bringing in those preventative services to help keep that family together, who might be grieving, who might have a loved one who just passed away, who went to the hospital and didn't come back, who was struggling. And so there are resources. You can reach out to the court system, to either family court or to criminal court through contacting the local police department and connecting that family member, that household member with services.
That's great. I appreciate you all really touching on mental health. My last question for you all as we wrap up is for each of you. How have all of you been helping your community, our community, during this time of a global pandemic? And for our viewers, how can they help in your efforts?
I would like to start with that one. I think one of the major things for me is to be present. To be present. I did not hide. I knew that as a nurse, that's what I'm called to do. As a mother, that's what I'm called to do. As a pastor, that's what I'm called to do. And as a community activist, that's what I'm called to do. As an elected official, that's what I'm called to do. So having all these hats, there was no way I could have gone and hide under my bed. I couldn't do it. So I muscled myself. I decided, this is what I'm going to do. I live with a husband who actually health is not in the best condition, but we protected ourselves. We took care of ourselves first. And I was in the front line. As I said earlier, I was all over helping others and making sure that they see me and they knew that they know somebody who cares was going to be there in the trenches. I have a history here with the homeless population here for the last 18 years, helping them. Every Sunday morning, we feed over 1,000 people here in Phoenix and Chandler area. there. So I wanted them to see me out there with them in the trenches, knowing that I was not going to go away. So that also built the trust. So when we came with doctors, we came with other people to help do the testing and telling them to take their vaccine, they were able to listen because I had that 18 years of history with them, of building that trust with them for them to see it. So I couldn't walk away. That's I think that was the best thing I could have ever done, was to be present and stay in the trenches and continue. That helped me because I had to stay healthy, because I had a responsibility to stay healthy for the other people that were around me. So that helped me to take care of myself mentally, physically, and also emotionally. Spiritually, I had to. So I was doing all of those by being present.
For me, I've been a loyal and partner of the community since the onset of the pandemic. I've had a live Facebook show that's been on the air for 5 years, but since the inception of the pandemic, I have devoted my time entirely to educate the community, the diaspora, and to decipher the complicated issues related to COVID. And I think that I'm really content what we have achieved for once, because for instance, when the vaccine started, a lot of people said, of my audience did say that they would not take the vaccine. So what I've done, I display myself taking the vaccine live on the show. So, and I was able to convince a lot of people to take the vaccine. So, and I'm still with them. As a matter of fact, right now, for those of you who do not know, that COVID is rampant now in our homeland, in Haiti. And again, last night I tried to give some advices how to approach this new wave of COVID in Haiti. So as the other panelists said, I've not hidden. I've been there, and I continue to be there for the community.
I'll go next. So I've been trying to use this as an opportunity to educate the community. I usually do community programs and workshops on different areas of the law, just to help kind of bridge that gap between the courts and access to justice. But now that the pandemic hit, and so many people in communities of color, Haitian people who are passing away, I use it as an opportunity to educate people about estate planning and getting a will, talking to our loved ones about our assets and where they are. You know, sometimes as Haitian people, we don't want to talk about death and parler suicide deep too. And I use this as a platform, and I'll say in 2015, I was elected to become a Kings County Civil Court judge in Brooklyn, where I live. And this year, I'm actually a candidate running for Kings County Surrogate Court. And the biggest challenge has been talking to people and educating people about what surrogates court is. And that idea that if you pass away with a will or without a will, you have to go through that surrogate's court to make sure that all of your assets and everything you worked hard for gets from one generation to the next. And really, we're talking about our legacy, our wealth building. So I was using this as a platform to really be able to educate people first about this window where COVID hit us so rapidly. And now we are at the mercy of this court, of surrogates court, to make sure that all of our assets and property that we have really gets transferred. And those who now we are here and still have that window of opportunity to create, to write a will, a power of attorney, a healthcare proxy, have someone who is assigned and understands what you want when or if you become ill, what type of healthcare you are willing to undergo, and who in your family has the authority to make those decisions. Because oftentimes we saw in the pandemic, our loved ones were dropped off at the doorsteps of the hospital. And we really relied on our nurses and our healthcare professionals to communicate with our loved ones and really to make decisions over our loved ones' lives. So this is the window of opportunity to educate the community about getting a healthcare proxy, about getting a live-in will, about outlining what healthcare directives we want to see for ourselves if we become incapacitated, and really how to preserve our wealth through using estate planning.
For me, this phase has really been a lot of reflection. I'm a person of faith, and so too much is given, much is required, and we're called to use either our time, talents, and treasure. And so I would encourage all of you on the line, you have time, you either have talent or you have treasure. And there's something that you can do in the community. So for me, that means community education, reaching out to local churches, ones that I attend and ones that I know that serve our people, and really educating about the vaccine. I've spent a lot of time counteracting historical mistrust around clinical trials, really going into community, hosting conversations, listening, and then going back to those who work in those spaces to share, these are our concerns, let's communicate differently. What can you do to continuously bring resources to our community? So if you're interested in learning more, if you're interested in learning how to host those conversations in your community, please feel that you can contact me. My information, I believe, is right on the screen, but also some of the other things that I'm working on personally are some clinical trials around diabetes, hypertension, obesity, which we know are some of the most important or really the most dire comorbidities in our community. And so I would love to continue to engage with you all, but really more than anything, know that you have time, you have a talent, and you have treasure, use it.
Well said. Unfortunately, that was not our last question. One question came in from online. Quickly, if everyone can just chime in. When do you all predict things will get back to normal? We are on year 2 now of this pandemic.
That is a tough. That is a tough question.
What's that?
Doctor, you want to take that one?
This is going to be a new normal. I definitely defer to the medical experts on that side, but this is going to be a new normal. Even the way we have shifted to virtual, the way that we have changed our work environment, that we're predominantly not going into the office space anymore, that we're working from home. And some of it works. Some of it has worked. I'll tell you, in the court system, we've been doing virtual hearings, virtual conferences. In some regard, you still need to be in the courtroom. You know, you want to see the face of the witness and who's testifying. You want to see the body language and things of that nature. But a lot of it has been working, allowing people to come into the conference from home, litigants and attorneys. So some things I think that are working we'll continue to do. And then there are things that, you know, we just wish we can go back to life as we knew it.
Yeah.
Well, just to give a scientific answer about this question. Now, I think that at the beginning we said that we all have to get involved. So it depends on expedient. We all involved in the vaccination process. So for us to get back to normal, what we expect to be normal, at least 70 to 90% of the American population need to be vaccinated. So far we are not at that point yet. And as a matter of fact, when the CDC changed the recommendation to lift the mask, and they interview about 723 epidemiologists, and they all said that we're probably going to have to carry our mask. 80% of us will have to carry a mask for 1 year. So it depends how fast we move. It depends how people comply, and we still have a 22% of people hesitant to take vaccine. We still have 8% of people who received the first dose who did not get the second dose. So it's all a matter of, it depends on us. But actually, to give you an answer, we will get back to normal when at least 70 to 80 to 90% of American population is fully vaccinated, of all ages. And as a matter of fact, one caveat that's very important, we will get to normal when kids are vaccinated. Now we just started getting kids to get vaccinated. So the children play a pivotal role in normalcy. So we have a long way to go for now. So we'll see what happens.
You know, as the doctor put it, scientifically speaking, those are the numbers that are really going to get us to that level. But I will suggest that we do a mindset change for our own personal lives, those that are around us, because we have not been given the spirit of fear. And so we cannot continually live in fear. We're going to have to get to the point where we made up our mind, those of us who, however, we're going to want that normal to be for us. If it's vaccination, let's by all means, let's get ourselves vaccinated. But there are people who will never want to take the vaccine. And for them, they will have to create their own normal again, how they're going to continue to interact with the world that is around them. I will encourage people truly, sit down with your family, make a plan, just like a strategic plan, just like you do, as the judge explained before, how we put all of our debts in a row when it comes to our wealth and everything else. We can do the same thing with our health, and we can do the same thing in the how do we move here from there. We are innovative people. We are very resilient people. As a human being, you can't kill us this easily. So we will always find a way to rise up and keep multiplying ourselves. But in the same way, we have to do it in a manner that we protect those that are around us as we protect ourselves. It's not only us. We have to look for those that are around us. That's my norm right now. I have a norm. I'm back to norm. I'm taking care of myself. I'm taking care of those that are around me, taking care of my children. So I am in the norm right now. This is my norm. This is where I thrive. This is where, because you produce fruit where you are planted. This is where we are planted in this moment, in this time. It's not going to go back. It's not going to go forward. It's right here, right now. I'm normal. There's nothing that I'm going to look forward to. I'm going to go back to. I'm right here, right now. I'm normal.
I love that. You bear fruit where you plant. I love that. I love that. And I think another great point is that we're going to arrive to normal at different times. That's going to be deeply personal, what that journey is going to look like. As people of color, I think we are adept at adapting. That is something that is in us, and that's part of who you are. But also sort of question to yourself, what are you going back to? What is the urgency to go back to this normal? What part of that are you running back to? And part of that is socializing for me, but other part of that is like, actually, there's a lot of the normal that I want redefined, and this is your opportunity to do exactly that.
Awesome. I love that. Yes.
Well, everyone, thank you all for having me. Again, I am Nancy Metayer. It was a pleasure moderating this panel and learning from each and every one of you. Please, again, if folks want to continue engaging, please check NAAHP and coordinate with them to get each of these individuals' contact information. If you like this conversation so much, please share it, click on it, and continue sharing it. Again, thank you all so much. I learned so much from you all, and have a great evening. I'm going to go ahead and pass it back to our hosts.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.